Hello, welcome to the channel Nursing in Handy. So today we will be seeing about concepts, principles and trends in pediatric nursing. So why we are more concentrating on the concept and principles, because from the ancient times till now there have been many changes, very many manipulatives in the pediatric nursing aspects. So we will be seeing in detail about what all the trends have been taken place from the ancient times. So what are the ways of implementing the nursing care on the pediatric population, and we are more concentrating on the pediatric population due to their vulnerability, and they have the right to seek the medical intervention from the hospitals. So we are responsible as a pediatric nurse to provide the nursing care in a meticulous manner, and also to compare how the nursing care has been changed from ancient to now. So in introduction we'll see about the major resource of the country is children's, and major population is being comprised of the children's population, that is about 60%, and which comprise of children's and mothers. And moreover, we are concentrating on the children and mother due to their vulnerability population, because they have the right to seek the medical intervention. Next we'll see about the definition of pediatric nursing. Pediatric is a term derived from the Greek word pedia, means child, iatric means treatment, and ix is a branch of science. So pediatric is a synonym of child health. So pediatric refers to the comprehensive and continued care of child at both wellness and illness. So as a pediatric nurse, we are not only concentrating on the wellness we are not only concentrating on the illness of the child, but also we are concentrating on the wellness. We are just following some of the nursing strategies to promote the health, and also to have the health restoration and health maintenance. So as in the context of pediatric nursing, we are doing a nursing care between the illness and wellness. So we are also improving the health status of the child, that is we are health promotion, health restoration, and also wellness, that is preventive measures. Some of the preventive measures we are being following on the pediatric populations in order to prevent the major complications in the children when we diagnose any disease conditions promptly and give the prompt treatment. Then the stay of the child on the hospital gets reduces, and in the same way the health status of the pediatric population improved. So if pediatric population health status is improved, automatically the family members will get improved their health status. Next is definition. So pediatric is concerned with the health of infants, children and adolescents, their growth and development, and their opportunity to achieve full potential as adult. The definition is by Richard E. Berman. So according to this definition, we are more concentrating on the pediatric population from the newborn, that is from the newborn infant to the adolescence age group, and our main motive is to improve the health status of these pediatric population, because once they attain the teenage, they are going to get stepping into the adulthood. So when they are going into the adulthood, they should have a full potential and immune power to enter into this adulthood. So when you follow some of the promotive measures and preventive measures related to the health, then they will have a healthy lifestyle when they enter into the adulthood. So for example, they are following the exercise patterns, lifestyle modifications, improvement of the nutrition status, automatically they will have a less incident or prevalence rate regarding the hypertension or diabetes mellitus in the future days. So this is the main concept of pediatric nursing, that is we are concentrating on the pediatric population to have a better health of adulthood. So we will see about how the ancient times the health have been shifted to the new recent times. So before, that is the ancient times is being listed down in the table as shift from, and how it has been changed, that is trends of pediatric nursing is under the topic of focus on. So first point is in ancient times it was a disease centered care, and now it is being changed to child centered care within the family system. So disease centered care means when the pediatric is being admitted in the hospitals, we only focus on the disease. For example, if a child is being admitted in the hospital for diarrhea, so our main motive as a nurses or a medical care professional is to treat the diarrhea and also do the discharge of that baby. So our main motive is only on the disease condition, but now it is being changed to child centered care. That means we are not only concentrating on the physical status of the baby, but also we are concentrating on the mental and social well-being of the baby, and also we are concentrating on the family system. Next is discouraging the families on neglect of female child. So before and all we were not much more intervening on the female feticides, and also some of the family members will neglect the female children. But now it is being, we are taking various measures to protect the female child, and also we are doing a nutrition surveillance and health promotion, especially for the female child. Next is starting care of women after she became pregnant. Once before and all in ancient times and all, when the mother becomes pregnant, then only the nursing care starts. We used to give iron and folic acid supplementation, calcium supplementations, and also the nutritious food and protein rich supplements we used to give. But nowadays how it has been changed is, once a partner is being planning for their pregnancy, we are starting the prenatal vitamins. We are encouraging the mother to take iron and folic acid in order to prevent the neural tube defects in the babies, and also we are encouraging the mother to have a lifestyle modification in the child. That is the changes from ancient to now. And next is special care of the sick child in hospitals. So in ancient times we were very much concentrating on the sick child. That is, only the special care is given to the sick child in the hospital. Nowadays it is being changed to the comprehensive care of the child from the day of conception throughout the developmental years of child. So we are concentrating on the pediatric population from the 0th day of conception. Once the mother is getting pregnant and she is being identifying with the help of urine pregnancy testing kit, or during the physician visit, if the mother is confirming her pregnancy, from the day we are starting our nursing care on the pediatric populations. Next is, in ancient times there was caring for the physical condition of the child in isolation. So we were only caring on the physical condition of the child. For example, if a baby is being admitted for diarrhea, so we as a nurses only care on the physical status of the baby, to improve their fluid status, to improve their orientation, and to improve their health status, and also improve their oral fluids. But nowadays it is have been changed to holistic care. That is, we are more concentrating on the family centered care. Family centered care means we are including these family members into the care of the babies. For example, I am telling, like if we are going to give the IM injection to the babies, you are involving the parents, that is a caregiver, mother or father. During that IM injection, we are asking the mothers or fathers to hold the baby in order to prevent the fear and anxiety in the children. So that is the difference between the ancient times and the new times. That is, from disease centered to child centers. From the neglect of female child, now it is being considered as the female child is the future of the world. So next shift is from illness oriented to health promotion oriented care. Next is not allowing parents to be with the child in hospitals and having a rigid visiting hours. But now it is being changed. We are having a flexible visiting hours for the pediatric population. For example, a child is very much interested in seeing their family members. We are allowing the child to have the visiting hours. Even the visiting hours is not there, we are allowing those members to meet the child in order to prevent the fear and anxiety in the hospital, as well as to provide the environment, that is child oriented environment to the babies. Next is previously the care was only hygiene and treatment oriented, but now it has been changed to warmth and love oriented. We are encouraging the parents and the caregivers to give more warmth and love to the babies. And previously it was providing routine care. So routine care means you have to in ancient times you have to fulfill the basic needs like self-care abilities, nutrition, sleep pattern. So the completion of routine care was focused on, but now we are focusing on quality in terms of play, recreation and nutrition. So in the many of the pediatric hospitals, you can see in a tertiary care hospitals, in the pediatric ward, nearby pediatric ward, there will be a play zone. So the babies after getting the treatment or any diagnostic procedures, the baby can go and utilize those play zone and use the play articles, and also they will feel like they are being in the safer place, and also they feel like far away from home, and also in the same way they will not have any fear and anxiety towards the hospitalization. And we are also maintaining on nutrition pattern of the babies. Why? Because we will also compare the nutrition of the babies with the recommended dietary allowance, and we will compare and we'll see whether the baby receives the proper protein diet or not, carbohydrate is there or not, micronutrients is there or not. So we will compare it with the baby's nutrition status with the recommended dietary allowance. Next is traditional practices was practiced earlier. So whatever we are doing, the nursing care has been came from the long ways, and we do that nursing care in the same way, but now it has been changed to evidence based nursing practice. So we as a nurses, we do a meticulous nursing research, and we identify the perfect nursing care on the patient, and we do follow that evidence based nursing care. So we have evidence, that is by doing a research we get some result. So depending upon that result, we are going to employ those results on the patients, and we are going to see the effectiveness of nursing care on the patient. The effectiveness can be either negative or positive feedback. So when we get a positive feedback by doing the research, we will employ those strategies on the patient. So for example, helper skin technique is being very much helpful in reducing the pain in the child. So in that way we do evidence based nursing practice and do it on the patients. Next is concept of pediatric nursing. In the concept of pediatric nursing, we have a health promotion, health maintenance and health restoration. These are the three components of concept of pediatric nursing. So health promotion means before any occurrence of disease, it is like a primary prevention. So before the occurrence of any disease, you are going to do a health promotion in the child. In the same way, you are going to follow some of the nursing strategies to prevent the disease condition in the children. For example, there is one of the leading cause of the infant or the child mortality rate is diarrhea. So major cause for diarrhea is bottle feeding. So you are going to do the proper cleaning and sterilization of the articles, and also you avoid the bottle feeding and you shift to palade feeding or katori spoon feeding. By doing this, some of the measures, you can prevent the disease like diarrhea, or you can prevent major complications in the children. That is known as health promotion. Next is health maintenance. Health maintenance means you have the baby has occurred with some illness. You are going to promote some of the measures to have the health maintenance to prevent the further complications. You are bringing back the child from the disease to the normal status. Next is health restoration. That means some complication has occurred, you are making the child to live with the disease, and also you are improving their coping strategies on the health condition. So for example, due to some unavoidable situations in the road traffic accident, the child is being ended with the crush injuries of their extremities, and there is a surgery plan for amputation. So once the baby is going into amputation, you will do the you will provide braces to the child. In the same way, that is known as tertiary prevention, that is a health restoration. So next we'll see about the current concept of pediatric nursing. So some of the current concepts are advocate for child and family, communicate for the child, activate the child activity, disseminate information for the child, educate the public about child health, motivate people in care of child, investigate available resources, and collaborative care. So we will see one by one in detail. So advocate for child and family means, for example, the physician has said some of the health counseling to the babies or the children or the families, means we as nurses going to carry out that process by the physician, and we are going to get those information to the children and family members. Next is communicate for the child. Next is activate the child activity. So how you can activate the child activity is like in many of the pediatric hospitals we have a playing zone. So you will encourage the child to go and do the play activity, and also you are including this play therapy in your nursing care. Next is disseminate information for the child. So whatever the child undergoing any treatment process or diagnostic process, you have to do the proper documentation. Next is educate the public about child health. So in the community setup, we are going to educate about the child's current health status. Next, motivate people in care of child. So you are also motivating other members of the family members to take part in the treatment process of the babies. Next is investigate available resource. So whatever the resource being available for the health services of the child or the family, you should make them to utilize it and get benefited by those services. For example, health counseling or giving a play therapy to the children or nutrition counseling, these all should be implemented, and also you should see that these services has been inculcated by the children and the family members of the particular child. Next is collaborative care. So nursing care is not only a single dimensional care, it is a multi-dimensional. A collaborative care means we cannot take any decisions independently. You have to consult with other healthcare professionals like physicians, pharmacists, dietitians, physiotherapists. So you are going to get collaborated with the other healthcare members, and you are going to give the nursing care to the babies. So that is the current concept of pediatric nursing. So next we will see about the principles of pediatric nursing. So first principle is building a working relationship with the parents and the children from the time of first contact. So first, when we receive the children and the family members, our nursing care starts by having a mere working relationship, that is therapeutic relationship with the family members and the child. Next, the nurse should be aware that all the behaviors of the parents and child are meaningful. Accept the parents and their children exactly as they are. Allow them to know that their problems are important and the nurse is there to aid in their solution. So you should give assurance that whatever in the treatment process or diagnostic procedures, we as nurses will be standing along with them for the benefit of the child. Next is allow the parents and the children to express their emotions. Whether they want to cry, you allow them to cry. They want to ventilate their feelings or emotions, you should allow them to ventilate their emotions. Also, you have to speak in an understandable language on the patient. For example, the patient is about she or he knows only Tamil language, means you have to speak in Tamil language. In many of the hospitals we have a translators. So based on their language, you have to connect the translators with them, and you have to explain them in their understandable language. Next, you should ask only a limited questions and a single questions at a time. So if you prompt a single question, means you will get the answer. So you have to drop only a single question at a time. Next, have empathy for parents and children. So empathy means you have to put yourself in others' shoe, and you have to see how the parents or the children will be feeling about. Next is must help the parents to feel that there is a unity among the health team. So you should make assurance that all the members from the hospitals are working for the benefit of the child and family. Next is principles of care of children. So growth and development, it should progress from chronological age and development level. So each and every health of child have their own growth and development level. You have to assess that. Next is health promotion. So same as that of concept, health promotion, some of the strategies we are following is proper nutrition, proper exercise, safety, play, immunization, injury and infection prevention. So when you follow these measures, you can automatically have a health promotion. Next is family focus. So our main motive is to give a family centered care, that is involving the family members into the health status of the child. So you are going to involve on the family centered care, support, love, security, values, belief, attitude and practice. Next is child advocacy. In some of the critical situations like violence, abuse, neglect, infant mortality rates, you have to provide counseling to those victims. So as a nurse, you are also going to act as a child advocate. Next is communication. You have to do a proper verbal and non-verbal communication based on the conditions of the child and the family. Next is application of nursing process. So this is one of the most important process in any of the nursing care, whether it is a pediatric nursing care or psychiatric nursing care or adult health nursing care. We are going to do the application of nursing process. The foremost step in nursing process is assessment. So assessment involves subjective data and objective data. So based on the patient verbalizes, you are going to assess the patient. For example, the patient is telling you like, I am having pain. So you are going to assess the pain with the help of pain scale. So based on assessment, you are going to frame out the nursing diagnosis. Next step. So you are going to prioritize the nursing diagnosis. So which is more needed and which is much needed, we are going to give the nursing diagnosis. So based on assessment, you are going to give the nursing diagnosis. Then is nursing planning. So planning, so whatever the condition is, you are going to do the planning of that particular process. For example, the baby is having a dyspnea. So if there is a dyspnea means you will do the assessment of respiratory status. So whatever the complaint the baby is having, you are going to give that assessment. And next is implementation. So whatever the nursing care you have provided, you are going to give the implementation of that particular nursing care. For example, you have done assessment of respiratory status. Then in implementation, you will write like the assessment of respiratory status is done. So what and all you have assessed, what respiratory status you have assessed, like that you will do in implementation. Next is evaluation. Whatever the nursing care plans you have been planned, whether it is been effective or not, will be done in evaluation. If it is a positive feedback, you will continue the nursing care. If not, you are receiving the negative feedback, means you will change the nursing planning, and according to that you will do the nursing process. So as a nurses, you cannot skip any one of the steps. That is, first is assessment, next is doing the diagnosis, prioritizing based on the symptoms, and next is planning of the nursing care, and after planning you are going to do the implementation, and after implementation you are going to assess the condition of the child, and you are going to do the evaluation. For example, in assessment you have done pain assessment. So based on pain, you are framing out the diagnosis. Based on Nanda diagnosis, you are framing out the pain as a first priority of nursing diagnosis. Then you are going to do the planning for that pain. So first you will do the assessment of pain status, then you will provide a comfortable measures, you will provide a comfortable devices to the patient. So you will be planning some of the measures on the patient. So after that you will do the documentation. Whatever the nursing care you have been given, you do the documentation. After the documentation, you will come to know whether the pain has reduced or not. If it is reduced, it is a positive feedback from the patient. If it is not reduced, you have to again redo the nursing assessment, and you have to alter the nursing care plans. And also, each and every nursing planning has a rationale, that is scientific principle. Each and every movement of the nurses requires and also follows the scientific principle behind each and every procedures. That is known as application of nursing process in all the aspect. That is whether pediatric or psychiatric or adult health nursing, everywhere you have to use this application of nursing process. Next, the main topic of the nursing profession is ethics in pediatric nursing. First one is non-maleficence, second is beneficence, third is justice, fourth is respect autonomy, fifth is veracity, next is fidelity, next confidentiality, and the last one is informed consent. And we do follow even many more ethical principles in our profession, and this is some of the main ethical principles that every nurse has to follow, and the nurse has the qualities of following these ethical principles in their profession in order to prevent the ethical and legal issues related to the nursing profession. So first is non-maleficence. So all the nurses will follow this non-maleficence. It is very equal to know that doing a good is good. In the same way, doing no harm is also very responsible. So for example, non-maleficence means if I am giving some IM injection to the baby, that IM injection should not affect any physical status of that baby. So when you are doing the goodness to the patient, in the same way you should also not do any harm to the patient. That is known as non-maleficence. So beneficence means you are going to do whatever the nursing care you are going to do, it is for the benefit of the patient. So that is doing good. So if you are planning for any nursing plans or nursing treatments or any medical treatments, it is for the benefit of the babies. Next is justice. Whatever you are doing, it should have a justice on the profession. Next is respect autonomy. For example, if a baby is going for any surgical intervention, so you have to explain them about the surgical intervention, complications and everything, and after that you will make the parents or the caregivers to decide whether the surgery, that is, you are going to get the informed consent from the parents, and also the parents will decide whether to continue this treatment or not. So you are going to give the decisions on the hands of the caregivers. So as a nurses, we will only we will only employ the information to the patient or the caregiver. Only the caregiver will tell about the conditions. Next is trends in pediatric nursing education, that is use of child and infant simulators. For example, we have a simulator of Paladi spoon feeding or Paladi feeding. So first we have to do it on the simulator, then only we have to employ those procedure on the patient. So when we become very practiced and master in doing the Paladi feeding in the simulations, then we have to employ it on the real patients. That is use of child and infant simulators. Next is inclusion of multicultural care topics. In all the culture topics have to be included in our education. Use of clinical site experiences. You have to take the nursing students into the clinical site areas, and you have to make them to experience each and every aspects of growth and development. And we mainly focus on the health promotion, disease prevention and nursing programs. And also increase focus on bringing of nursing education into the community. So into the community area, you have to bring out the nursing education by imparting the knowledge. So some of the latest trends in pediatric nursing is, as we have already discussed in the previous slides, that is flexible visiting hours, rooming in mechanism, that is involving the caregivers in the treatment of the child, parent support groups, school teachers are also involved in the care of the hospitalized child. Play is being inculcated in the schools and hospitals, that is play therapy. Next is care by parents, that is family centered care. Health and nursing team, evidence based nursing care, prevention of disease and promotion of health. So our main intention is to do a preventive measures and also promotive measures of the health, and also to do the evidence based nursing care. As a nurses, we should have a thirst towards a nursing profession to do the research on our nursing topics, and we have to find out the results, and by finding out the results you are going to employ on the patients. That is known as evidence based nursing care. So far we have discussed about the concept of pediatric nursing, latest trends in pediatric nursing. So from the ancient times, how it has been shifted to the recent times. So these all are the some of the concept and trends, and also the changes from the ancient pediatric nursing to recent times of pediatric nursing. If you have any doubt, kindly drop down in the comment section, or if you want me to discuss about some other topics related to some other nursing subjects like psychiatric nursing, adult health nursing or pharmacology, kindly drop down in the comment box. We will see in the next videos.